Toy, thank you, sir. Well, it is springtime, and just like us humans, our pets can have allergy issues with the changing seasons. And Dr. Tamisha Hubbard is our vet specialist today, along with Dr. Jerome Williams, our regular guest here today. She specializes in veterinary dermatology. Good morning.
Good morning.
Good to see you.
Good to see
you. So it's just like humans, like we said, right?
Right.
And
so seasonal allergies, they affect dogs, they affect cats. And so with all the pollen that we're seeing right now, it can be a serious problem for our pets.
So can they get sinus infections like we do, or how's it work with them?
So usually they exhibit their clinical signs through the skin more so, or through ear infections. So you'll see more so that they have lesions on their skin. They'll itch, they'll lick, chew, bite, scratch. Sometimes they'll get reoccurring ear infections. So if you're seeing those problems, then those are things that you need to consult with your regular veterinarian about. And if the regular veterinarian can't do anything about it, then they send them to me.
All right, explain what we're looking at.
So this is basically red inflamed paws due to the pet licking excessively. In the previous photo, you saw some lichenification and hyperpigmentation. So those are the areas of the body that are normally affected when we're talking about dogs with seasonal allergies. So that red, dark, inflamed skin, this is what pets do to themselves when they're that itchy as a result of the seasonal allergy.
So we may think, gosh, they've been outside, they've maybe gotten to something, or you think of fleas when it's something totally different.
It could be something totally different. So all of that pollen that's out there, they can inhale it through their nose, they can lick it or ingest it through their mouths, or if they get it on their coat, it can be absorbed into the skin. So those are the different ways that we see those allergens affecting the skin. Human dander, they can be allergic to us. So we exfoliate our skin, it falls off, collects in the house, they sniff that up their nose, and they can be allergic to it.
Wow, Dr. Williams, what do you normally see when you realize it might be that kind of problem?
Well, it's that time of year, so we, consider that in our diagnosis because spring and fall is when we see it most profoundly.
What are folks usually coming in for? The dog's got a problem, their ears or something?
Yes,
what do you see?
As Dr. Hubbard mentioned, the scratching, the itching, occasionally coughing. But, we see that excessive scratching and itching and whatnot, that is beyond the normal. And what we saw in those pictures is something that's going on for a while. It's more chronic, so catch it before it gets that far. You see them scratching and itching and going on.
Yeah, those are obviously some of the more severe problems there.
Correct. Yeah. So these are all things that we can see associated with seasonal allergies.
We're out of time, but how's it treated so folks can know?
So we can treat it many different ways. We can formulate a serum based off of the allergens they reacted to.
So you test it just like you do a human to see what it is.
An intradermal skin test is done, and we can identify what we need to put in a serum. We teach the owner how to give injections or drops by the mouth in order to clear it up.
And then that way our pets are not suffering anymore, because they really are, aren't they?
They are.
All right, thank you so much. Again, what's the name of your place? What folks want?
So I am the Alabama Veterinary Allergy and Dermatology Service. We're right here in Birmingham.
All right, and we
know Dr. Hubbard is so very good.
Yes, she is. She is. We appreciate her so much. And Dr. Williams over the mountain, or Red Mountain Animal Clinic, I should say. Good to see you both.
Thank you.
Good to see you three. Sorry about that. All right.